Good day, everyone. I'm Dr. Homer Lim for the concerned doctors and citizens of the Philippines. Would like to make this video. It's called COVID-19 Home Care. I'm making this video specifically to all the patients who are right now at home, who are positive for the infection or you are suspected to have COVID. However, because of the inavailability of hospitals, because all the hospitals are full, I'm making this video to at least help you, as well as for those who are at home and you are concerned about if you do get infected, what can you do? So this is just a very short overview of what you should have at least at home. I just like to make a point that some of these things that I am mentioning, you will need doctor's guidance. You will need a doctor's prescription. Please, if you do not have a doctor yet, I sincerely hope you get somebody that you know and you can trust, because home treatment requires constant and sometimes even very close monitoring, especially those who are very, very sick. So at home, you should have this, okay? Paracetamol, aspirin, nasal decongestant, mucolytic, okay? So especially the mucolytic bromhexine as well as N-acetylcysteine, they have been found to be very, very effective in treating COVID patients, okay? Melatonin, vitamin C, vitamin D, quercetin, virgin coconut oil. You may not have all of them, but at least you should have your vitamin C, vitamin D, and melatonin, okay? Now, quercetin, you might have a difficult time finding it. Uh, you can get, pwede kayong bumili ng talbos ng kamote if you cannot find quercetin, or if you can, kaya nyo kumain ng onions or garlic na hilaw, why not, right? Virgin coconut oil. Okay, serpentina, I'm sure ngayon nyo lang, maybe some of you ngayon lang nyo narinig, but in Thailand they already are approving this as a treatment for COVID. So, because they found out that serpentina or yung Andrographis paniculata has some form of activity against COVID. They did a tawag nating in vitro or in the test tube, no, study of serpentina yung sa atin sa Pilipinas against COVID in Thailand. So the government has approved this as use, so now they're using it in selected hospitals as treatment for COVID infection. Of course, the most important thing that you have to have at home is a pulse oximeter. Okay, you need a pulse oximeter whether you are in your 30s, 40s. Okay, you will need a pulse oximeter. Okay, now aside from thermometer and the pulse oximeter, if you have anyone at home, okay, anyone at home over the age of 50 and they have like diabetes, heart disease, they're obese, o may sakit sa heart, sa kidneys, sa lungs, any of those diseases together with you being above 50, as a home care uh, management, you need at least an oxygen tank or a concentrator. This is very, very vital. Once you get low oxygen, you're gonna have a hard time looking for oxygen tank. So I would suggest you get an oxygen tank at least on standby, so you won't have to be running around looking for oxygen. Okay, because again, if you go to the hospital, they don't even have enough people because ang haba ng pila sa emergency room. So at least get an oxygen tank or a concentrator. And lastly, you may want to, if you have already, then that's good. If you have a steam inhalation device, that's good. If you don't, you can use a big glass or big bowl and then just inhale the steam. No, this is a very good. Whatever they are saying that it's not effective. The point there is, if you have steam, at least that would help clear some of the mucus from your nasopharyngeal cavity if you're having hard time breathing. No? So, our again, as part of the advocacy of yung citizens, concerned citizens, doctors and citizens, no, is to first boost the immunity of everyone, prophylaxis prevention for everyone who is highly exposed or vulnerable. Vulnerable are those who are, again, those who may sakit sa puso, diabetes, kidney disease, heart disease, no? So these are the vulnerable ones. And of course, those elderly, okay? And of course, we treat early. We treat everyone. Once you have symptoms, we treat immediately, okay? So again, boosting the immune system, your vitamin C, vitamin D, virgin coconut oil, zinc. Again, quercetin. If you don't have quercetin, talbos ng kamote. Oh. Raw onion, you can make a juice out of it, or you eat garlic. Okay, that's quercetin. If you don't like quercetin, mabaho or whatever, you can take a green tea, no, in matcha. So this contain EGCG. So also very good against COVID. Melatonin at bedtime, especially for those who are unable to sleep properly. Of course, then we have what we call yung serpentina. One capsule twice a day or tea decoction. Again, Serpentina is wala talagang study aside from what Thailand has did. However, you don't lose anything. It's just a small capsule or tea decoction. You don't need to take too much. I don't suggest taking it too much. So again, if you have signs of COVID, cough, colds, body pain, difficulty of breathing, when you have body pains and difficulty breathing, you treat it immediately as COVID, okay? Unless the test shows otherwise, okay? So if you once you have signs and symptoms, you definitely have to isolate, okay? However, everyone of the same household are presumed to have COVID, unless of course you have been tested already. Now, the question is, kung yung asawa ko nagka-COVID, do I need to isolate myself from her or from him? Technically, you don't kasi you've been together for like, forever. So if your husband or wife is already having signs of it, most likely you already been infected. So you have to, so you may not, if you have no choice, then you don't need to isolate. You can stay together because most likely you've already been uh, infected with the virus. Okay, so again, we treat everyone as having COVID unless you have been tested. Okay, and everyone, all of you, must monitor themselves for signs and symptoms. Okay, and once you do, aside from monitoring, of course, please call your doctor for a consult. Okay, what we want is to treat you as early as possible. Please don't wait for 1 week after getting signs and symptoms before you see your doctor or you call your doctor, because it might be too late. So as early as possible, call your doctor, get your prescriptions, get the drugs that you might need when you do get infection. Okay, so now in cases wherein you cannot reach your doctor, okay, hindi sumasagot, or out of coverage area or whatever, okay, if you are over 50, always check your pulse oximeter, especially those over 60, 70, and 80. Wala silang nararamdaman. Most of the time, their pulse oximeter nasa 80 na, 70, wala pa rin. Tawag natin dun, happy hypoxemia. Happy meaning parang walang nangyayari, and yet their oxygen has significantly dropped to very critical levels. So if you have your family members, your parents, your grandparents, you have to check their pulse oximeter every hour or every 2 hours. Just make sure na hindi bumabagsak ang oxygen levels nila. So if your oxygen on the pulse oximeter is below 95, recheck, change your finger, palitan yung finger, baka may problema lang sa blood flow dun sa specific finger. If it's same, below 95, you have to immediately put your oxygen. That is why, as part of the home care kit, you need that oxygen. Kasi once your oxygen drops below 95, below 90, para ka nang nalulunod. You cannot get the air inside your body, inside your lungs, malulunod ka. So that's why it's important to get that oxygen as standby because sometimes you cannot wait. Okay? Now, so how do you put on the oxygen? So you put it, meron siyang regulator, you open that, you put it, may nasal cannula or may mask, no? So you put it first at 2 liters, check oxygen, tumataas na ba? If it's not going higher after 3 minutes, increase 2.5. Increase every 0.5 yung line, may 2 point may line kasi yung sa oxygen regulator, 1 to 5 or 1 to 10. So you increase every 0.5 liters every few minutes until you get your oximeter reading na above 95. So that's your target, at least 95. Okay? Now, if your pulse oximeter reading is always below 90, with full, tinodo mo na lahat ng oxygen, sa pinakadulong-dulo na, it still won't go up, then you have to prepare for possible hospitals. Ibig sabihin, the COVID infection has affected the lung so much na too much fluid na or too much phlegm or mucus na it's not accepting oxygen even with full oxygen tank. So you have to be aware of this. You cannot have a persistently oxygen of below 90 kasi that's already very, very dangerous. Okay? And of course, if you're going to buy oxygen, once you start using oxygen, you have to make sure you have refill available. A lot of patients, they forget, and the family, they forget. Sa gabi, they're naka-oxygen. And then middle of the night, biglang naubos. So we're gonna get oxygen. So once you start using that oxygen tank, you have to prepare to get a refill. Okay? The refill will also depend on how much oxygen you are using. So if you do start using oxygen, you have to call the person or the company that you got the oxygen to get a standby oxygens, and then you can refill and recycle that oxygen tank. Now, for early treatment protocols, okay, now based on the FLCCC guidelines, which is ivermectin, the dose is 200 microgram per kilogram body weight daily for at least 1 to 5 days, depending on how you respond. Now, for those who are not aware, or there is there is available ivermectin from compounding pharmacies. Uh, However, because compounding pharmacies are konti lang, they cannot produce so much. So you have to be aware that there are also ivermectin in the market. Out there that claiming to be from Dr. Homerlim. No, I do not sell any form of ivermectin other than other than what is legal. So whatever is out there, sabi from the United States, from India or whatever, they are not registered. So we don't really know how is really ivermectin. So and of course, we have to be careful where we get our ivermectin because marami talagang fake, and I've seen some fakes already. So please be aware that I do not sell those in blister packs or in. So the only thing that I would suggest is you get it from compounding pharmacies. Okay. And then, of course, as part of the protocol, it's ivermectin with doxycycline or azithromycin. So, of course, you cannot get this without prescription. Therefore, that is very important to get in touch with your doctor as soon as possible. Okay? So, aside from your antibiotics, you take your vitamin C, your vitamin D, your zinc, aspirin. Okay? Aspirin is very important, especially for those who are persistently mataas yung fever, no? Masakit yung katawan, so you might need some aspirin. Of course, you have to make sure that you don't have allergies. A lot of people are allergic to aspirin. Just in case wala kayong aspirin, you can take turmeric. Turmeric also contains of aspirin or acetylsalicylic acid. Okay, and of course, melatonin. Melatonin has been found to also decrease inflammation. Okay, for those who have COVID, so you can take melatonin in the morning, lunch, dinner, and of course take it at bedtime to help you also sleep. No, but of course for those who are taking melatonin, sometimes they do get drowsy. So I would suggest if you get drowsy, you just take more melatonin at bedtime, disregard the melatonin in the morning, lunchtime, and in the lunchtime. Okay. Okay, so if you do have ivermectin, okay, if you have, make sure to take ivermectin after a meal, not before. Why after? Because it's better absorbed after a fatty meal. Okay, if you have aspirin and you are on steroids, you also have to take it after a meal to avoid gastric discomfort. Okay, so make sure the person who is infected, or let's say the whole family is infected, make sure you are in a well ventilated, okay, with temperatures of at least between 25 26 degrees Celsius, because patients, of course, when you have infection, you don't like too cold, but of course you don't want to be too warm also, because if it's too warm, then yung fever talaga will become higher or become worse, no? So if you, again, for early outpatient, as much as possible, they need to eat. However, make sure that it's easily digested. Okay, easily digested. So I suggest yung mga warm mga soups, no? Not too much meat, okay? Maybe fish and lots of vegetables as possible, and maybe a bit of fruits also, okay? So avoid phlegm-forming foods, kasi yung phlegm-forming foods, that will make you even cough kasi dadami yung phlegma. So these are your milk, your cheese, as well as wheat, okay? So always check your oxygen, your BP, your heart rate. So most of patients with COVID will have a higher than normal heart rate. That's because of the fever, especially, or for those na medyo mababa oxygen, of course tataas yung heart rate. So always check, make sure that your vital signs are okay, in, you observe that if it's too high, then you need to consult again with your doctor. So if your oxygen is persistently low, you definitely will need steroids. Okay. However, steroids, you need a prescription. So steroids in the form of budesonide or methylprednisolone or prednisone. However, you need a prescription from a doctor. Okay. So, that's a bit short overview of how to do your home care treatment at home. At least that would buy you some time, especially if you don't have a doctor, you haven't contacted a doctor, that you give you enough time to at least help you managing this COVID. Again, COVID, it's not a death sentence. It's 98% are mild and asymptomatic. It is those who have who are very have other diseases, and those who are very old, who are likely to get severe forms. So these are the people that we have to watch out for and monitor. We can treat it together. I've treated now, I would say over 5,000 now, because most of the time when I treat them, you don't treat one person, you treat the whole family, because all of them seems to be infected. So that's what's happening now in NCR. A lot, the whole family is infected. So we can treat this properly if we do it early. Okay? And again, we are as strong as the weakest link. What I'm trying to tell you here is, if one of you would get sick, okay, most of the time the whole family or the whole household will be sick. So it's very, very important for everyone to make sure that your immune system is as strong as possible. Try to sleep early, especially the kids. Try to sleep early. Try to avoid watching too much television, or too much of the social media, especially if it's already past midnight, because definitely your immune system will take a big hit. Of course, just a reminder that we as Filipinos are probably the most resilient human species in the universe. I'm sure we can get through this. We just need to be properly informed, properly educated. Uh, so thank you, everyone. So just a last, if everybody's thinking alike, then somebody isn't thinking. So what I'm trying to tell you here is, we have to think outside the box. There are many, many ways how we can combat this infection. I hope this short video can help you in treating or managing COVID at home. Thank you so much. Thank you for listening. This is Dr. Homer Lim again for the concerned doctors and citizens of the Philippines.